everybody, and welcome back to What Did You Learn? My name is Ahava Leibtag, and I'm very excited to have with me here, believe it or not, two Bryans, who are the co-founders of Tidal Health Group. They do marketing communications for private physician practices, and I'm really excited to learn from them what their experiences have been during the last 700 days that we've been trapped in this pandemic. Bryan and Bryan, welcome.
Awesome. Thanks so much for having us.
Yeah, thank you so much
for having us.
Yeah. So I want to get to what you do exactly at Tidal Health Group. But before we do that, the audience loves to hear a little bit about you. So what was your favorite ice cream flavor for emotional eating during the pandemic?
Wow.
Mine's easy and it didn't change. Is vanilla with peanut butter sauce.
Basic with a twist.
Yeah, mine basically anything rich and decadent from chocolate on chocolate type deal. So
yeah. So my favorite ice cream was Ben & Jerry's Super Fudge New York Chunk, whatever it's called. And then my husband brought home Caramel Sutra, and I've been changed as a person. It's like, oh my God. Now there's more to emotionally eat. So, Bryan, before we started recording, you were telling me about some of the things that you've stood up during the pandemic in service to your clients. So if you could talk a little bit about, those two different practices and what you did for them, I think it would be really interesting to hear what the needs of the client were and how you answered them strategically and tactically.
Yeah, certainly. I mean, it's kind of a reflection of we represent ourselves as kind of outsourced marketing managers, trying to be as agnostic to the community in large. And one of our partnerships is with a technology company that supports our live chatbot, and AI chat. One of our clients is one of the largest primary care practices right here in Manhattan. And when things kind of hit the wall on March 17th, we were actually really early on helping them onboard their staff and call centers just to help with communications. And understandably, those communications just exponentially went out the window in volume those following weeks. So we had to scramble and help not only train and onboard, but really just shorten life cycle and understanding workflows and communications down to the written word.
Yeah, I know for myself, I've grown as a leader in my own empathy for my team, but I think also so we do a ton of content for hospitals and healthcare systems, and sort of watching them struggle through this, really like not having enough cash and not knowing what to do and having to treat all the COVID patients that they had and trying to figure out if there was going to be a surge, how to deal with their internal staff. I mean, I think it really made me realize how important communications is, even though I knew that because I chose to be a communications professional, but also what a hard job we have because we have to balance the strategic needs of a business with, the empathy that we're supposed to have for our audiences when they're going through something tough. So if somebody had come to you on, let's say, February 1st and said, and either one of you can answer this question or both, Bryan, I want you to know that this is about to happen. What do you think you would have done to prepare for it?
Yeah, I think I would have taken a step back and tried to create some kind of uniform in communications. I think there was such a fragmentation, especially as things went remote, that no one knew where kind of the central source of truth was. So if we were able to kind of create better processes around where are we going to find what's most up to date at this minute, there would have been an even faster life cycle of just updating information.
Yeah, and then to add to that is just create a strategic game plan, like really get in the weeds with them, and even there's a range of services that we offer, but they're not always uniform across the board. So maybe just developing those additional avenues to be able to communicate not only with potential patients or the public, but also existing patients.
The thing that I learned the most was how resilient we are and how adaptable we are. And a lot of it comes out of the fact that I've seen us be so nimble, particularly in business. Clients that used to take 6 months, to get something out had to do it in 6 hours, sometimes 6 minutes, they just, like you said, things were changing constantly. Have you found that agility and nimbleness has sped up? And what's your prediction for whether or not it'll stick once this is over?
Yeah, 100%. I mean, I think it's a reflection as our clientele, just on their size, generally have the ability to be a little bit more nimble. But even in this time, the just learning life cycle for something that might have taken weeks, months, or even years to implement, you just didn't have that time. So we had to throw things at the wall and then real time be available to support and iterate.
We've learned, it's okay to be messy and be a little bit faster at things and kind of launch things prematurely, and then just iterate from there versus being a little more, stalwart and slow not to adopt it, but just to make sure you get all your stakeholders involved and on board. So we've learned that that's part of that nimbleness is it can be messy on launch as long as, it's saying the right things. It just may not be perfect.
So you talked before, Bryan, about this like consistent messaging. Like it doesn't really matter how you reach them or where you reach them, as long as the messaging is consistent and you become that pillar, that trustworthy element. What have you done to tell your clients, like, you need to be that source of truth because it's so politicized out there and it's so terrifying for people? I think one of the reasons that the infodemic has been so powerful here is that this is a new disease and scientists are learning about it. So what you heard yesterday may be different than what you hear today because they're learning in real time also. So what is some of the advice that you give to your clients to say to them, this is how you maintain that trust that you've already built, or here's how you create that trust?
Yeah, I'll go like a very kind of specific marketing answer is like we're constantly sifting through search data, and you'll see this giant shift after March of just people appending COVID against your specialty and how does it affect me and what to expect. And there is no answer or information really in anyone's websites because it's so new and constantly evolving. So we're really pushing back and showing that this is new search data and it's only going to behoove you to position yourself behind it, because then you will be seen as the authority on it. There's a lot of technical things underneath that we do, from schema and data implementation, but it all comes down to the written word and putting your voice and authority behind it.
Yeah, I think we always push for our clients to be, they are authorities in their field. And so whether that's their own research or reviewing literature, but to be that voice, because the doctors and the physicians and the practitioners have built trust with their patients, and just visiting them, you're trusting them that they are an authority and that they know better than you or I. And so to keep that messaging stream going and giving them updates on the the latest and greatest information is important. And then also making sure that's transmitted on the other platforms, and especially on the website is being able to physically see when that source of information has been updated is a huge thing, and that there's someone of authority that's actually proofreading it and reading through it to make sure that it is one of their voice, but two of their authority.
Yeah. One of the things that I said in the beginning is timestamp everything and pick a doctor who's going to be that central voice about, everything that's going on, because the CDC says that when you hand it to a politicized figure, like a political figure that people have elected, half the people are going to believe that person and half the people aren't. So I always think there should be one person talking, representing that group.